energy healing, whether it's pranayama in yoga or chi movement and needles in acupuncture or traditional Chinese medicine. I think those are kind of hard to sometimes understand until you feel it. But those of you who have tried it usually will notice some kind of change. In a nutshell, if I was to send somebody to Reiki or to you, what exactly would they experience or expect in the first visit?
Okay, so with the first visit, we'd have a little bit of a conversation to kind of find out what's going on with you. We work on a physical, mental, emotional, and spiritual level. So somebody might come in with shoulder pain or knee pain or some other area in their life that's causing disharmony in their body. And we want to know, we want to release that disharmony from the body system. So the energy with Reiki or some of the other healing practices that Dr. Siegel mentioned, it's a universal life force energy that we know now with quantum physics and everything, that everything's energy. And with the medical equipment, you can measure the electromagnetic field of the heart and the brain waves and stuff. So we know that this energy field exists. So there can be imbalances in the energy field that can be released during an energy healing session. So some practitioners will place their hands on specific body parts of the client on the table or work around in the energy field just wherever they are feeling heavier energy or a different type of sensation. Usually it's like a magnetic pull in the practitioner's field or hands. So most of the time, clients on the table are going to feel the energy moving in their system, but not always. There are people that feel absolutely nothing during a session, but when they get up off the table, they feel more relaxed. So after the initial talking, then they get comfortable on the table, and then there will be some nice, either a white noise machine or some soothing music, and sessions last anywhere between 20 minutes, 50 minutes of actual table time. And while the client's on the table, it's nice and quiet. The person goes into a nice, relaxed state. And if you want to look at it from a medical perspective, is that like an alpha brainwave state or theta or whatever? Still conscious.
Just to explain, those of you who have seen my lecture on sleep, going in, most of it, like right now, we're talking in beta wave, and the brain's firing off and problem solving and interpreting. When we get into nighttime, it usually goes to alpha. It goes slower and slower and slower. So you can see it. I'll put a link to the previous video I did on sleep. But it eventually gets into stage 1, stage 2, stage 3, REM. And those REMs are the ones that I always talk about. If you have enough REM at night, you're refreshed in the morning. So, and then Jill mentioned MRIs and EKGs. Those things, those tabs, for those of you who don't have experience in EKG, it's when you get those tabs, sticky tabs, wire goes to the machine, and we read whether or not the heart's beating properly or is a pattern of an MI, myocardial infarction, heart attack. And that's all from energy. We measure impulse, electrical impulse. MRIs measure with enough energy into the patient, enough energy coming back. MRIs will measure differences between thickness of tissue. Skin, bone, soft tissue, muscle, brain tissue, even water. So that's the concrete explanation for energy.
I'll ask the patient I'll say, okay, I'm done, or I'll sound actually a harmonic tuner or ring a bell, just so the patient knows that the session is completed. And then you can take as much time kind of coming out of it. Like if you kind of feel like you were in a really deep, relaxed state, you don't have to jump up off the table just because the session is over. You would take your time coming back, the term we would use is coming more back into your body, but not like you actually left, but just coming more into awareness, more into that beta brainwave state. And then I'll ask you some questions. Did you see anything? Did you have any visions or visual experiences? Did you see colors or anything come into your mind's eye? Did you hear anything outside the normal sounds of the room? Did you feel anything in your physical body? And again, there's no right or wrong answer. Some people do, some people don't. But what's really great about this energy, and I may have already said this, is that the energy is an intuitive energy. It's a loving life force energy that animates us, right? So this is a very positive, life-affirming energy, and it knows where to go in the body. So if you came in with shoulder pain, but you actually had an underlying issue somewhere else in your body, the energy will go where it needs to go in the body and prioritize. Ideally, there is always some form of shifts in the physical body, in the mental body, the emotional body, and the spiritual body. And it's just when your body can enter a deep state of relaxation, the body normally starts to go into homeostasis. So
that makes a lot of sense. That's what we always talk about with that serotonin balance. And when I talk to people about trying to get in for a lifestyle change, it's to get to balance, whether it's moving a little bit or practicing a relaxation practice or having a good nutrition practice. It's all resetting things, especially if you're really off. So that makes a lot of sense. In acupuncture, if we have a stuck area, we call it stuck because it's energy, but usually stuck equals pain in most people, I think. So if I can get a needle above and beyond, or above and below the area of pain and force energy to move, then most people will kind of feel good. The stories I've told about when Joseph Helms put needles in my shoulder and I was better than like 2 years prior. I think there's mechanical things I've explained on my videos before about loosening up the pectoralis and maybe loosening the trapezius muscle, but there's also the energy part that is hard to explain to a beginner, but again, you have to experience it. And that's a good question. Is there an age limit to what kind of clients that you'll see?
no, I've worked with babies before. I've worked with pregnant women. I've worked with, trying to think, the oldest client I had was in her 80s.
And side effects?
There are no known side effects to any form of energy healing because it is that positive, life-affirming, loving energy that exists all around us. Having said that, some people experience something called the healing crisis, and this is of debate in among healing practitioners and those who teach different types of healing modalities. But sometimes when there's an energy block released, people will feel strong emotions and they'll label them as bad. Emotions are emotions. They're meant to move through us. So while somebody might consider that a bad thing or a side effect, or, well, this session didn't work because now I'm sad. But if that sadness in your system is being felt and released, then that's not really a bad thing.
Part of the healing process.
Right. Or, I've had clients that after they've had a session have lost their job. And they were, they're like, well, what did you do to me? But they hated their job. It was
Right.
making them, an emotional wreck. So, and then they end up, 9 out of 10 times, unless they stay down, in the victim mode, which again, there's nothing wrong with that. We all visit there. You just don't want to stay there.
Right.
Sometimes people would equate that to a bad side effect, to an energy, because the energy started moving out through the system.
Right.
But we're always at choice. So for those that keep doing the lifestyle changes that you would instruct them to as their physician, you're constantly moving the energy and it's not getting restuck. So that would be the only contraindication, really.
Okay. If I have somebody I wanted to send to you, or if somebody wants to send a family member that's not doing well, but they're very stubborn, they don't believe, but they've just been talked into it, will that, if you have a naysayer, will that negatively affect the outcome?
It potentially can, but Eric Pro, which is one of the doctors that I had trained under from one of the modalities that I practice, he tells a funny story about this gentleman that the wife dragged him into the office, and there was just no way this guy was going to allow any type of healing to happen. He was a total naysayer. He got up off that table, and it was a pain that he had had in his body for a very long time. I think it was back pain, but I'm not positive. He got off that table and the pain was completely gone. Completely gone. So he, became a believer. If there's a hidden benefit to holding on to this pain, then chances are, even if they believe, it's not going to be released. You know what I'm saying? If there is a hidden agenda...
Secondary gain.
Yes, secondary gain.
Okay.
Then it doesn't really matter. Eventually there will start to be energy shifts, but that could impede it.
Okay.
But ideally, you'd work through that in a session, either consciously or subconsciously, through the energy work.
Any problems with having you as an energy healer and then having like a visit in 2 or 3 days with a counselor, where you might have emotional letting go, a psychologist or counselor, pastoral care, any problems with that?
Not at all. In fact, everything works really, really well together. This is never in place of any, medical care from a medical doctor or a therapist or anything. It all works really well together.
Okay. And final question before we start. If I have somebody that we just put on, some people need herbs to stimulate or calm down mood or improve sleep. So if I use valerian or CME or magnesium changes, and or prescriptions like Zoloft or Paxil if they're really bad, would you want them to wait a little while before they have an energy session?
No, with this type of work it does not matter at all. There may be some other forms of energy work that I'm not familiar with that may be important, but not in the particular work that I do or have trained in.
Excellent. All right, let's get started.
Feel parts of your body moving, like twitches or whatever, totally normal. You may feel your eyes going back and forth. That just depends on what brainwave state that you're going into. Again, all perfectly normal.
What happens if the patient falls asleep?
Which does happen, and again, that's totally fine.
You'll still continue with the energy healing.
Oh, sure. And a lot of people will snore. And some people actually snore and still be awake. And they'll be conscious of it. It's all fine. The only thing that I, ask you to do, you don't have to set a specific intention for this. You've already set the intent to receive this healing energy for your highest and greatest good. Monkey mind may start jumping around or whatever. Just, you could bring it back to the breath if you want to, bring it back to your heart space, whatever. I will ask you a series of questions when we're done. I already mentioned that. Did you see anything? Did you hear anything? Did you feel anything? So you can kind of maybe set your mind on that task, so it's not quite as, doing your to-do list or whatever. But other than that, your job is to just relax and receive. All right?
Sounds good.
Do you have any specific questions for me?
No.
All right, so take a nice deep breath in and exhale when you're ready. One more nice deep breath in and exhale when you're ready. And then we'll go ahead and start.
So I've just finished the energy session with Jill, and I had a couple of sensations that came about during the session. Some muscle twitching. Jill, with her intuition, felt a couple of different areas. She had told me a lot of energy that was coming from the heart, whether that means blocked up energy that was moving or energy that was being released from the heart. The concept, I guess I want you to understand it, and I felt very light after she was finished. It took about an hour. So this concept of being light, just the word that popped up, and when Jill explained it to me, it made a lot of sense. I guess with a lot of emotional release, or a lot of energy that bad energy especially, that starts to leave and good energy comes in, you can have a sense of feeling light. And whether that's translated to pounds or grams, or whether it's a sense that the body feels lighter, it still felt that way. And my left brain will always tell me, well, maybe it's just placebo, maybe it's because I'm filming it, maybe it's because I'm feeling something inside, I miss my dad and I want it to happen. And you know what? It doesn't matter. Even if it was, at the least, if this is all placebo, I'm feeling something really cool. And if I feel something really cool, that means you know that there's serotonin being secreted. I'm going to go to black and white again. You know that serotonin is being secreted. As far as how long it takes to heal up, it really depends on how screwed up you are, or how many medical problems you have, how deep you are in your one medical problem, or how deep you are in the several medical diseases that you have. So bottom line is that it is another vehicle to get you better faster, but if you don't commit to your own change of lifestyle, then that attempt at an energy session, or if you think about that attempt with a physical therapist, that attempt with a registered dietitian for nutrition change, the attempt at going under surgery underneath the knife for having bypass, all that is going to fall out to the wayside if you do nothing to make a lifestyle change. So it's all up to the individual. All these things and all the healers that I use, whether it's an energy healer or a specialist in medicine or a nutritionist or a physical therapist or exercise physiologist, it's all to get you to another summit. You just have to understand that. If you don't make any changes, or if you can't make those changes or can't design them, then have somebody else design it. But either way, this is just another vehicle. I think it's very powerful. It has now been about 2 weeks since the energy healing that I had with Jill Chesero, and I wanted to give some feedback. In this last two and a half weeks, I've had several things occur, very emotional, very spiritual, and actually physical too. And I won't go into details, but I explained to Jill what was going on in our follow-up conversation that we had. And which took me back, but she gave some very nice suggestions on how to interpret those things that happened to me and how to use that interpretation to continue, hopefully, developing more energy, an energy feel. Just like exercise, you don't want to start an exercise program when you're really suffering from arthritic or orthopedic problems. You want to get there beforehand. Same thing with energy healers. I thought I was doing fine, but I actually was able to feel a little better after the session. I only use a session to show my patients about what energy healing or Reiki amounts to, and I've used it before, but I've never had the experience in the hands of somebody as good as Jill. So I really think that it can be used as a complement to your health care. But you have to be wise in how you find an energy healer. You have to be wise in how you use an energy healer or utilize an energy healer with other forms of either physicians or physical therapists or exercise nutritionists, all forms of the people that get you to be healthier can be utilized. Just have to have somebody to help guide you on how to intertwine all those things